Hi, my name is Leah, and I'm a current fourth-year medical student at the University of Birmingham. I was fortunate enough to be a recipient of the 2021 Royal College of Radiologists Undergraduate Elective Bursary, and today I'll be speaking briefly about my intended project and the adaptations that I've made to this due to the pandemic. The elective planning process this year was quite different to how I imagine it has been previously. I originally started off emailing what felt like every hospital in the entirety of South America, with no luck in finding a placement. At the time, the situation with COVID-19 had taken a turn for the worse across the continent, and I decided it would be best to start looking elsewhere. I honed in on India as my next option, as I have family there that I thought might be able to help me out in finding a suitable hospital. Sure enough, my grandma helped me research hospitals in the city of Pune, where she lives, and after countless more emails, I was finally able to secure a placement at the King Edward Memorial Hospital. Here, I arranged to shadow both a clinical oncologist and a hematologist during my 3-week elective. I titled my project, How Are Cancer Patients Mentally and Emotionally Supported by Clinicians During the Stages from Diagnosis to Treatment, and I aimed to produce a reflective report on my observations and experiences whilst in India. As the title suggests, I wanted to focus on mental health care integration and the nature of the doctor relationship during the cancer journey. I chose this topic as a way of integrating my interests in oncology and global healthcare. As well as this, being of Indian heritage myself, I was keen to return to my home country and learn more about the cultural and social factors and the way that these play into healthcare delivery and uptake. I have previous experience volunteering in a rural industrial hospital in India from when I was 16, and I was really looking forward to returning again, but this time with 4 years of medical school under my belt, hoping to build on my clinical skill set in an unfamiliar setting. But why this topic and why in this location? The epidemiological landscape of disease in India is changing, with cancer representing an increasing burden in terms of incidence, mortality, and pressure on healthcare facilities. This graph is based on figures provided by the World Health Organization and shows the projected increase in cancer burden for India over the next 20 years. Psychiatric disorders such as depression and anxiety are a significant contributor to oncological morbidity and have been evidenced in multiple studies as negatively impacting disease trajectory in India and the UK alike. Despite their high prevalence in cancer patients, particularly as their disease progresses, they remain frequently underdiagnosed and therefore unaddressed. Unaddressed psychiatric disorders in cancer patients correlate with longer stays in hospital and increased frequency of GP appointments. Psychosocial departments in oncology are often underfunded and understaffed, presenting an additional barrier to mental health services. This further emphasizes the need for integrated mental health support and signposting for cancer patients. Only 2% of people with mental health problems in low and middle income countries actually receive treatment for these. This statistic is even more shocking when you consider that 85% of the world's population live in these countries. With regards to India specifically, while there was plenty of data on the paucity of and barriers to mental health care in India, the research regarding service uptake was relatively limited and sometimes contradictory. A consistent finding, however, was the negative impact of stigma on health-seeking behaviours regarding mental health. There was particularly little information on service uptake and addressing mental health problems in oncological settings, which inspired me to acquire my own experiences in this area. I planned to actively seek out experiences in oncology clinics to help me with my project, noting my observations down in a structured logbook. I based the logbook loosely on Rolf's model of reflection, as its broad foundation allowed plenty of flexibility for what I anticipated to be quite subjective observations. I included sub-questions for analysis such as what went well, and how could this have been made a more positive situation for those involved. In addition, I included specific consultation elements to observe for that patients have identified in previous research as positive contributors to their clinical interactions. These included sincere and clear communication, so no euphemisms or ambiguous terms to soften the perceived impact of information on patients, empathy, avoiding jargon, whether ideas, concerns, and expectations were addressed, both of the patient and of the family, and whether patients were signposted to mental health services. Another thing I wanted to look at was how conversations about the impact of a cancer diagnosis on mental health, or the patient's mental health in general, were handled by the clinician and received by the patient. Now, I'm certain you are all probably wondering how on earth I'm going to India, given the current COVID-19 crisis over there. And the simple answer is, unfortunately, I no longer am. On the 26th of April, India saw the highest number of new daily COVID infections ever recorded in the world. Even before this record figure, the situation in India had been deteriorating severely, with hundreds of thousands of new cases recorded every day since the beginning of April. It became clear that my elective plans in Pune were not going to go ahead. Now, before I talk about the adjustments I've made to my project since, I would like to touch briefly on the situation in India as it stands at the moment. Today, the country faces a national shortage of hospital beds, medical oxygen, and vaccination supplies, all of which has necessitated the mobilization of considerable international help in order to overcome the crisis. This photo is of queues outside a vaccination centre. Hospital staff are having to queue up for hours to fill up portable oxygen tanks, and healthcare systems are buckling, in some cases, have collapsed under the strain of the skyrocketing cases. Here you can see mass cremation sites that have been set up in public spaces, with makeshift funeral pyres, as crematoriums and funeral homes have become overwhelmed with the number of daily deaths, despite working around the clock. To say the country is in crisis would be a massive understatement. The situation in India is extremely dire. Watching my home country suffer from afar has been beyond heartbreaking. I would like to use this opportunity to encourage anyone listening to look into the crisis and consider donating to India's COVID-19 appeal. I've included a few recommended charities and NGOs at the end of my presentation. In the meantime, it looks like my trip to India is going to have to wait. I hope to travel there in the future once the situation is settled and carry out my original elective plans at some point. But for now, I have a remote backup project that I will complete from the UK instead. My revised elective project is entitled The Effectiveness and Impacts of Integrating Palliative Care Methods Early On in Oncology, and will focus on the areas detailed here on my presentation. I plan to conduct a review of existing relevant literature and form conclusions and recommendations around identifying the appropriate stages to begin integrating care, the components of good quality palliative care for cancer patients, and the potential benefits for patients and their families alike. I'm certain I'm not alone among this year's cohort of medical students in feeling disappointed at not being able to go abroad for my elective as originally planned. Whilst I do find my backup project really interesting, it's not quite the same as getting hands-on clinical experience in a new country. With this in mind, I've arranged to visit the Maggie's Centre in London during the elective period so I can supplement my literature review with qualitative observations and reflections. And I would encourage any other students in a similar position to me to seek out local clinical experiences to make up for missed elective plans. One final tip for next year's cohort when planning electives: I found the MDU's electives network extremely helpful in the planning process in terms of identifying hospitals in your target country and getting their contact details. I really hope the situation improves next year and all of your plans are able to go ahead. Thank you very much for your time today, and thank you again to the Royal College Committee for selecting me for the Clinical Oncology Elective Bursary.